Hi, everyone, and welcome to Practice Growth HQ. Now, today we're going to talk about something quite different. Many of you have heard the term interdisciplinary, where you might be doing a couple of sort of minor specializations within the same field. Well, today this is not interdisciplinary, this is across disciplinary. And my special guest today is Dr. Lewis Chan. Now, he's got a special interest in holistic dentistry, and he's focused historically on orthodontics, TMJ, and achieving facial balance. And we're going to see the impact on his business for this. But the other thing you need to know about Lewis is that he has completed a master's in Chinese medicine acupuncture, and he's found a way to integrate that into his dental practice. So all the way from Greater Sydney, welcome, Lewis.
Yeah, thank you.
All right, Lewis, we like to start with a fast five, kind of quicker questions, quicker answers to help people get to know you quickly. Question one, where did you grow up?
In Hong Kong. I was born in China, but grew up in Hong Kong.
And when did you move to Australia?
1988.
Okay, well, you've been here a long time. All right, question two, favorite book besides your own?
Favorite book? I don't actually read much. If I read anything, it's just textbooks. So I don't actually have a favorite book.
Do you listen to books or?
Yeah, listen to books. Actually, my favorite one would be The Plan's Paradox. I think it's pretty good.
Okay. I don't think I know that one.
About how we should eat. Yeah.
Okay, so it's called the
Plan's Paradox.
Okay, there you go. All right. Question three, what's one of your superpowers?
My superpower, somehow I just know where the acupuncture points are for patients, and I'm able to find the point that able to help them the best. Yeah.
Very good. Question four, something you wish your 20-year-old self knew.
IT is definitely a good field that I could have got into. I'm fixing people instead. Yeah.
Okay, interesting. I've never heard anybody say that before. And finally, question five, Lewis, something you're grateful for.
I'm grateful for just the people that I work with and my friends. They help me to kind of get to where I am at the moment. Yeah.
Okay, very good. Now, look, as I alluded to in the intro, your path has been a bit of an unusual one. And it's not to say that there aren't other healthcare professionals in Australia or indeed globally who will get qualifications in two different areas. But at least in my experience, the combination of the two you're doing is it's less common. Let's put it that way. Let me ask you this, like, what does your practice look like now, kind of on a weekly, maybe daily basis?
So daily, there's a lot of kids going in and out. There's a lot of baby in and out as well. So we end up seeing a lot of younger patients. It can be quite crazy sometimes. A lot of patients come from quite far away. So sometimes the whole family comes and the waiting room just filled with different family together. Yeah, so it can be a bit crazy sometimes.
Okay. Now, as I alluded to in the beginning, one of the things that you do is what you call achieving facial balance. Can you tell us a bit about that?
So because I see a lot of TMD patients, a lot of TMD patients end up like that because they didn't grow their face properly. So we've been seeing a lot of younger patients to help them to grow their face well. So they have better airway, better TMJ, so they don't end up being our adult patients.
Okay. And you've already alluded to this fact, and the fact is that I've interviewed Lewis previously for a magazine, which was a much shorter interview, and I was like, we definitely got to get you back on the podcast. You literally have patients coming to you, I mean, pretty much from all around Australia, but certainly all around the state.
Yeah, mostly in New South Wales. We have a lot from Port Macquarie, Newcastle, Nowra, Badmans Bay, and some from Queensland. Yeah.
Yeah. Now, the point that I would make that Lewis probably may not, but I mean, this is a podcast about growing your practice.
Yeah.
And listeners, most of you are not experiencing this in your practice because, it's fair to say you're probably choosing a more traditional path where if you graduate as a doctor, you're practicing pretty much as a doctor, maybe you specialize in a particular area. Same with dentistry, physio, et cetera, et cetera. But from my point of view, it's the combination of skills that you've picked up, Lewis, the dentistry, which is pretty kind of left brain, mainline, well established. But then you've put on top of this the Chinese medicine acupuncture. Tell us about that journey.
So yeah, I was seeing a lot of GMT patients, and a lot of them are taking a lot of medications, well, Western medications, and I can see they are not working. And there's definitely a better way, more natural way of helping them. So then I start doing some trichopon injections, trying to manage their symptoms. But ultimately, yeah, we need to learn how to help them to heal their body. And that's when I get into acupuncture and learn a natural way to regulate the body and help them to regulate themselves and help the body to heal better. So that's why I study Chinese medicine.
And when did you do that?
I got in at 2018, finished in 2022.
Okay, so you had qualified as a dentist and been practicing for how long?
I graduated in 98. Yeah, a while, 20 something years. Yeah.
Okay, that's very interesting. Now, look, one of the things which is so fascinating for me about this is that there would be a certain portion of the healthcare community that would go, Chinese medicine, acupuncture, it's all a bit woo-woo for me, Lewis. And, here's someone, you've worked in traditional medicine for 20 plus years, and then you added this extra element on and managed to blend it together. And at least based on where your patients are coming from, there's a real demand for this. I mean, have you had pushback from people maybe in the dental industry or healthcare? Kind of how come you're mixing two things which shouldn't be mixed?
Yeah, we don't have pushbacks from patients because they can see the results. Well, a lot of people don't understand dry needling is different to acupuncture. So as we explain to the patient, this is not dry needling because a lot of physiotherapists or chiropractor may use needles on like trigger point on muscles. They are called dry needling. And also when they see the result, when we just put the acupuncture needles in the acupuncture points, some patients even the parents can feel the difference from their kids when we do the acupuncture. So
you alluded to dry needling and acupuncture not being the same. I confess to being completely ignorant in this space. What is the difference?
So acupuncture usually is on acupuncture points. So the perfect example is, for example, if you have jaw pain, some physiotherapists may do dry needling on the jaw to release the muscles. So then you get less pain. But we will actually acupuncture the foot to ease the pain on the face. So that's acupuncture. But we also use a technique we call balance technique. We balance the whole body in one go. Apart from also add on managing symptoms by, for example, if someone come in with facial pain, we acupuncture all the limbs and some acupuncture on the scalp as well. So that's more acupuncture Chinese medicine style compared to dry needling. Yeah.
Okay. So look, I've had a little bit of exposure to acupuncture, so I'm not as surprised as some of the listeners may be, but I'm just going to repeat back to you what you said, which is for jaw pain, we'll do acupuncture on the foot. So how does that all work?
Well, so for example, jaw pain usually is on the stomach meridian on the jaw. And the stomach meridian actually go from the face down all the way to the foot. It ends on the foot. So when you acupuncture the stomach meridian on the foot, it helps with the face. So some people say it's from the fascia tension, you're changing the fascia tension, but there's a whole lot of different ways this affect the brain as well. So the reason we integrate the Western and Chinese medicine together is when we do acupuncture, we actually want to change the neurology from sympathetic to parasympathetic. So the person can relax first, and then we use acupuncture to heal them. So we use a Western technique to check the neurology of the patient to see whether they are in sympathetic or parasympathetic first. And then we choose
How do you do that?
It's called a motor nerve testing. So we get the patient to sit, and then we press on the nerve on the arm. It's a technique that orthopedic surgeon discover to check where the actual injury is. So, for example, some patients come in and they've been clenching and grinding. Sometimes can be airway, sometimes can be pain actually on their foot they didn't know. So we have a few patients come in, they have facial pain or clenching and grinding. And as soon as we acupuncture the feet, then they can relax, and then they stop clenching and grinding. So that's one example. Yeah.
So does acupuncture hurt?
It can hurt, it cannot. It depends. Most Western patient, Caucasian patient prefer smaller needles, but with more Asian population, they actually prefer to feel something. So if they don't feel the needle, they don't think you're doing anything. So it depends on the patient. Yeah, but generally we try not to make them feel anything.
Yeah, it's interesting. My wife, she goes to a chiropractor quite regularly, and I've heard chiropractors say, because you go and get your spine adjustment, and it's like, did you hear an audible crack? And the chiropractors basically said, look, you don't need the audible crack to have the adjustment. And yet it's a bit like the Chinese patients going, oh, Lewis, that didn't hurt. That couldn't have been a good treatment. Just let me, I want to go back to a question I asked you before. You said from the patient's point of view, they are not worried about you being, as it were, part dentist, part acupuncturist. But what about from, I suppose, your dental colleagues? I mean, have you had any sort of pushback,
No, because I usually, when I meet them, usually it would be at a seminar. So they probably heard of what I'm going to talk about.
Okay.
Yeah, I would say most people, when they find out, they're actually quite interested in how I get into acupuncture as well. And when I demonstrate how we do acupuncture, most of them happily let me do some acupuncture for them too. Yeah, no, I haven't seen much pushback, but I think the awareness is not enough. I think especially in the sleep medicine world, still a lot of people still focusing on the Western treatment, that of combination of Western and Eastern together. So that's what I'm trying to get more people to understand. Yeah.
Yeah, look, I think from my 2 cents, this for me is what's so compelling about your story, Lewis. I mean, I'm not a healthcare professional, but I come from a family full of healthcare professionals. And if I'm channeling my father or my grandfather, vet and doctor, respectively, at one level, if I can say this, if it was someone coming to Australia from Hong Kong practicing acupuncture, they'd be like, oh, yeah, good for him, but that's not the way we do things here. But the fact of the matter is you've been practicing as a dentist for more than 20 years in Australia in a very Western system. It's not as though you're off with the pixies. You're a kind of very left brain, sort of logical, science-based guy. And then you've introduced this thing, this acupuncture, which many of us in Australia don't know that much about. And it's such compelling evidence. It's like, wow, okay, well, here's a guy who's been a practitioner. We recognize all the dental stuff, but on the other side, he's doing this stuff which we don't know. So it kind of makes us want to pay attention. What sort of treatments can you do? And I suppose actually before I ask you that, what about the patients? I mean, are your patients, most of them of some kind of Chinese descent, or have you got a bit of a mixture in terms of their ethnic backgrounds?
Yeah, so most of our patients are not Chinese.
Interesting.
So yeah, it's quite interesting. So when we introduce acupuncture to them, especially when we do acupuncture on babies, they are still very open.
Mm.
And we said, yeah, we're going to use this to help them with the procedure because they will have less pain, and they are very open. I think, yeah, most Australian, they are really open to different things, but also our patients, most of them are referred to us.
Okay.
Maybe that's why they are more open, because they have seen other people, it hasn't worked as well.
Mm.
So when they come, they are generally more open to different methods.
Yeah, as you say, I mean, let's face it, any form of chronic pain is pretty horrible. And if you've taken a bunch of tablets for an extended period and you're not getting a return, and you've seen some other, experts in other areas and you're not getting the result, it's like there's some level at which it's like, oh, I'll give that a crack because it's got to be better than what I'm doing now. I'm not saying that they're poo-pooing what you're doing, but it's like,
Yeah.
hey, you got to go and see this guy. Like, he's really fixed me up. It's a pity, Lewis, that APRA's so restrictive on you using
Yeah.
testimonials, because I imagine you'd have some fairly substantial ones.
Yeah, so I would just say the only pushback may be just more APRA. We do need to be careful with what we do during the clinic time, but that's why I did the master's degree. Because with the master's degree, I'm a registered Chinese medicine doctor.
Okay.
I can talk about diet. I can talk about anything regarding the health. I can put needles anywhere. I can basically touch any part of the body with consent. So that's also, yeah, why I want a full license instead of just learning acupuncture.
We've spoken a little bit about the impact on your business, and I'm, yeah, having met you a number of times now, Lewis, I'm 99% sure that this change was not driven by a business point of view. It was you wanting to help the patients.
Yeah.
But nevertheless, what's been the impact on your business since you qualified and since you started offering these services?
So yeah, because most patients are referred in, we do work with a lot of chiropractor, osteopath, physiotherapists. So I think for them, they know I'm dual qualified, and I do understand the body to a different level than a normal dentist. So it helps a lot. And now we actually employ 2 acupuncturists in the clinic as a dental assistant, so they can help me with the acupuncture instead of me doing it myself. Yeah.
So would you say is it a relatively dramatic kind of before and after story for your practice in terms of before and after?
Yes. Well, in the middle of my master's degree is COVID. During COVID, our practice actually grew double because everyone start changing their view on health. A lot of people actually want to be healthier. So since COVID, yeah, our practice is growing and growing. So it has the biggest impact. It also stopped me from doing general dentistry after COVID.
Okay, so you were doing general dentistry beforehand, and now you don't do it at all.
Yeah, I always wanted to stop general dentistry because it started to get a bit boring for me.
Yeah.
But during COVID, the best thing happened is we can't do general dentistry.
Right.
So it's just amazing. We changed so much, and also we work out a way to do orthodontics that is more effective. We're changing to clear aligners because we can manage the patient long distance without them keep coming into the office. So yeah, there's quite a few changes during COVID for us.
Yeah, it's a curious one, isn't it? I've got a friend of mine who's in business, I mean, we're not here to rake over the coals of COVID too much, but one of the things that he did, I mean, because many of us, when COVID happened, were words to the effect of "holy crap," like what are we going to do? And he said in his business they adopted the approach that they adopted the mindset COVID will be the best thing that's ever happened to this practice. And in some ways, that's what's happened to yours. It caused us to sort of rethink things and determine what's important and so on. And kind of here we are. Well, that is a fascinating journey, Lewis. Have you had inquiries from other dentists sort of interested in going down a similar path?
Yeah, so among the people I contact frequently, like I teach with Damien Teo once a year. So now he is also qualified to do acupuncture. And there's a few other dentists doing acupuncture training as well. So yeah, we can see more and more dentists getting into the field. Yeah, so hopefully we start to integrate it a bit more. I was just saying last week, we do need more people able to do it. We're just going to be too busy and we can't help everyone.
Yeah, and I assume you personally, dare I say, booked out for weeks in advance. Is this true?
Yeah.
Yeah, and I thought that was the case. Lewis was referred to me by a mutual friend, and as I've alluded to a number of times, I just thought, what an interesting story. Of course, as the host of Practice Growth HQ, I'm wearing my business hat here, but it's just a lesson in, I guess, taking a slightly broader view. I mean, obviously, there's some dedication there to go and do a master's degree, but as I said, not interdisciplinary, but kind of cross disciplines. Well, Lewis, look, thank you so much for your time. I really appreciate it. And I'd say I also just appreciate you doing this because, a lot of people would have been like, I mean, I've spoken to lots and lots of healthcare professionals who, after a few decades, get sick of the kind of routine and they want to do something a bit more specialized. But for you to go and do this was a bit out there. It sounds like for the patients, getting much better results and I guess opening the eyes of us Westerners to go, you know what, there's probably something in the Chinese medicine. And for someone with your rigor and your Western medicine background to bring that across, we go, oh, well, can't be totally crazy because Lewis has been operating in a system we recognize. So good on you. Thank you so much for your time, Lewis. If people want to get in touch or find out more, what should they do?
They can look me up probably on Facebook, maybe the easiest. Just send me a message. Yeah.
Are you, so Louischan?
Yes.
Are there many Lewis Chans?
There's only two. One is Dr. Louis Chan. That's my professional one.
Okay.
And my personal one. Yeah.
Okay. All right. Well, once again, Lewis, thank you so much for your time. I really appreciate it.
Thank you.
All right, everyone. Well, we've covered a bit there, haven't we? Now, this is not necessarily a podcast where you've got a kind of 10 bullet points for you to go and implement, but it's more about a mindset. What is the thing that you can do that's a little bit different, a little bit out there, maybe that you can introduce to your practice to help you in your practice growth aspirations? Finally, if you got some value from our time together, please head to where you heard this show and leave us a lovely review to give us the encouragement to bring you more great content every week on Practice Growth HQ.